Welcome to the Deep Dive. Today we're focusing on, well, a really interesting aspect of global healthcare.
Which is?
Nursing in the Gulf Cooperation Council countries, the GCC.
Ah, yes. A region seeing a lot of change.
Exactly. We've got some info here that kind of lays out the scene for nurses over there. Useful if you're maybe thinking about working there or just, curious about global health trends.
Right. And the source really details the opportunities, but also, importantly, what's required.
So our goal is pretty simple. Pull out the key stuff, give you a clear picture of what nursing looks like in the Gulf right now, and maybe where it's headed.
Sounds good. A concise guide, essentially.
So let's dive in. Where might you actually find nurses working? Is it just hospitals?
Well, hospitals are a big part, obviously, but the information points to quite a bit more diversity.
Like
Outpatient clinics, community health centers, even schools are mentioned.
schools. Okay, that suggests nursing is pretty well integrated across the board, doesn't it?
It seems so. It's not just acute care, and the responsibilities reflect that variety.
Okay, tell me more about that. What are the core duties?
Well, you've got the direct patient care we expect, giving meds, wound care, monitoring vitals, all that,
Standard nursing practice.
pretty much. But there's also a real emphasis highlighted on health education. Preventative care seems to be a growing focus.
Ah, so promoting health, not just treating sickness. That fits with global trends.
Definitely. And for those in hospital settings, roles in surgery, critical care,
Yeah.
managing chronic conditions like diabetes, hypertension, those are specifically mentioned as key areas.
Right, those chronic conditions are a huge deal globally.
Precisely. And it shows the value placed on nurses. It's not just about following orders, it's complex case management.
And is it just bedside roles? Or is there room to grow?
That's a key point. The career path isn't flat. The resource mentions opportunities to move into leadership,
Such as?
things like unit managers, nurse educators, coordinators. So there's definitely a ladder to climb.
That's really encouraging. And something that jumped out was the demand for specialists.
Oh, absolutely. Advanced practice nurses, nurse specialists, they are apparently very sought after.
In specific fields.
Yes. Think critical care, ICU, ER also on ecology, high skill areas.
Which probably reflects the increasing sophistication of the healthcare systems there.
That seems likely. They need people with specialized training and experience.
So, okay, if you're a nurse, maybe a specialist, I'm thinking about the GCC.
Huh.
What do you actually need to get licensed?
Right. The practicalities, the info lists a few key things. First, a recognized nursing degree or diploma,
Standard enough.
and a valid license from your home country. Plus, you'll likely need to pass specific exams for the country you want to work in.
Like Prometric, I've heard of that one.
Exactly. Prometric for Saudi Arabia, or maybe HA for Abu Dhabi, DHA for Dubai.
It varies.
And what about language? I assume English is important.
Very. Good English proficiency is usually required. Sometimes you need to prove it with a test, like IELTS or TOEFL.
Makes sense in such international environments. Anything else?
Yeah.
Experience. For some of those specialized roles we talked about, yes. Maybe 2 to 3 years of relevant experience might be needed.
Okay, so it's a thorough process.
Yeah.
What's actually driving all this opportunity? Why the big focus on healthcare?
Well, a major factor is simply huge investment. GCC countries are pouring money into their healthcare sectors.
As part of bigger national plans.
Yes, often linked to things like Saudi Vision 2030 or similar initiatives across the region. They're aiming for world-class healthcare.
And that investment translates directly into benefits for nurses, I imagine.
It does. The resource talks about good career advancement prospects, leadership training, plus attractive salaries and benefits packages.
It paints a pretty positive picture for professional development.
And it also mentions access to continuing education, which is vital in nursing, isn't it? Keeping skills up to date.
Absolutely crucial. And what's the work environment like?
Very multicultural, according to the source. You'd be working with colleagues and patients from all over the world.
That could be a really interesting experience in itself. Is this demand likely to continue growing?
All signs point to yes. Things like Expo 2030, these ongoing vision initiatives, general healthcare reforms, they're all fueling a need for more qualified nurses.
So the region is actively expanding its healthcare capacity.
Definitely seems that way.
Okay, so let's try and boil this down. The key takeaway for you listening seems to be that the GCC is a really dynamic, growing area for nurses.
Yeah, lots of different roles, real pathways for career growth, and a high demand, especially if you have specialist skills.
It's fascinating how these big national projects and events are directly creating jobs in healthcare.
It really highlights the connection between national strategy and workforce needs.
Which brings us to a final thought to leave you with. We've seen how the GCC's investment is creating this nursing boom. Thinking globally, what other regions might be showing similar signs of rapid healthcare development, perhaps opening up comparable opportunities in specific health professions?
That's a great question. Where else is that level of focused investment happening? Something to keep an eye on.
Definitely food for thought as you navigate your own career path in healthcare. Thanks for joining us for this deep dive.